What I'm going to do is I'm now going to hand over to my colleague Dr. McFarland, who many of you will know from the clinic, who is a paediatric neurologist who works specifically in the mitochondrial clinic and also sees patients from outside of other patients, not just mitochondrial patients. We do work closely together because I think it's really important that we actually join up the care of people. Some of the patients here and some of the patients in the future will go from the children to the adult neurologist. But one of the things that Dr. McFarland is going to talk about are the particular problems that we see in children. When Dr. McFarland's finished, then I'm going to give a little bit of a talk about some of the advances that are happening in diagnosing and the genetic nature of disease. So over to Dr. McFarland.
Good afternoon. Can everyone hear me? Yes, great. Okay, I'm glad Kath put those microphones down. It wasn't just for her, it was for me. So as Doug says, he's taken my first slide now. I'm going to talk about mitochondrial disease and how it affects children. I do have a dual life. I am a paediatric neurologist and see children with other neurological disorders. And I see almost all of you in the mitochondrial clinic as adults. But I also see children in that clinic with mitochondrial disease. Okay, so mitochondrial disease in children. What we need to think about is when do children get mitochondrial disease? Why do those children get mitochondrial disease? What are the sort of problems that they encounter? And how are we as clinicians able to help children with those conditions? So just thinking about the first of those questions, when do children get mitochondrial disease? Well, mitochondrial disease, as we've talked about in previous talks and patient information events, can affect anyone from birth right through into the 70s and 80s. But in fact, children can get disease even before they're born, and we can pick this up on antenatal scans, provided we know the diagnosis in the mother. So the earliest that we can detect this condition is probably in the last trimester of pregnancy, the last 10 weeks or so of pregnancy. A lot of children are picked up with the mitochondrial disease at birth, and that's often because they present very severely at birth with problems with lactic acidosis, or the buildup of acid in their blood. That probably relates a lot to the stress of birth itself. They're then picked up again during the preschool years and certainly in middle childhood. And often at that stage, we think it may be because of growth problems. And then, as adolescents or teenagers, children are picked up again because they start presenting at that stage with the kind of illnesses that you as adults have experienced. I've just reflected that graphically on here. So this group, this little triangle down here at this end, are the small number of patients that we're able to pick up antenatally. There then is a peak at birth where we're picking up children with severe disease, and then gradually throughout childhood and into adolescent age, we're picking up more children with more and more adult type disease. So the second of my questions was what causes mitochondrial disease in children? And often what causes mitochondrial disease in children is similar, but not exactly the same as what causes mitochondrial disease in adults. And over the last decade, we've recognized the importance of nuclear genes. This is a chromosome, and chromosomes contain DNA. And they contain the vast majority of DNA, the information that codes the proteins and who we are. And they code 99.9% of the DNA in our bodies, but there is a little bit of mitochondrial DNA which isn't on these chromosomes. The chromosomes live in the nucleus of a cell, and mitochondrial DNA lives separately in the mitochondria. But the two do talk to each other. And what goes on in the nucleus can influence this mitochondrial DNA. So that if you've got faults in this DNA, in the nucleus, that can lead to problems with energy, and problems in this mitochondrial DNA similarly can lead to problems with energy. And rather interestingly, and we're still discovering and still understanding about this, but mutations in that nuclear DNA can lead to faults in this mitochondrial DNA. And faults so that the quality of that mitochondrial DNA is very poor, contains lots of mistakes in the information that's coded there, or there's just a decreased amount of it made. And in either case, that will lead to mitochondria not functioning properly. And mitochondria's primary job, main job, is to generate energy. If they don't have good quality DNA, or enough DNA, they won't generate that energy. So how do we look at this in children? Well, we look at it very much in the same way as we do in adults. We need to take a little bit more care, perhaps, in how we approach children with these conditions, often because they're very severely affected, and also because they are children and they need to be dealt with in a different way. And a prime example of that is the muscle biopsy. This slide actually shows a muscle biopsy being done in an awake adult under local anaesthetic. But in children, we have to involve the paediatric surgeon. They have a general anaesthetic, and the muscle biopsy is done under that general anaesthetic. And while this is generally very safe indeed, it's not without risk. And we don't undertake that unless we're very serious about the likelihood of finding something in that muscle biopsy. We can also look in blood, and increasingly we are also looking in the skin. And more recently, thanks to the diagnostic team, we're able to collect urine off children and look at that. And we're able to look primarily at defects in this mitochondrial DNA in all of these substances. And sometimes we're able to look at nucleogen defects, particularly in blood and muscle. So you've probably seen this slide before when you've attended previous evenings, and I think Professor Turnbull has had it in his talks during those events. But it really demonstrates the myriad of clinical disease that can present as a consequence of mitochondrial disruption. And lots of different organs can be affected. But I just want to go through a few that are primarily affected in children. This is an MRI scan. I don't think it's anyone in this room, so I get safe there. But it's just here to illustrate that brain involvement, particularly in children, is very common. Muscle involvement is also particularly common, and is one of the reasons that we actually perform the muscle biopsy, because muscle is often an affected tissue, and it's affected causing weakness, fatigue. In children, and perhaps this is another major difference from adults, in children, liver disease is often quite a prominent feature of mitochondrial problems.